Hello everyone, this is Dr. Anjali Kumar. I once again bring you greetings from Maitri. Maitri is a space where we talk anything and everything about women's health. So today we'll be talking about something which has been requested to me ever since I came on my daughter's channel. So yes, you guessed it right, we'll be talking about irregular periods, delayed periods, missed periods and everything around them. So in the last two videos, we spoke about what is a period and what is a normal period. Now typically the duration of a menstrual cycle is anything between 22 to 35 days, starting from the first day of the period till the first day of the next cycle. There is nothing called as 28-day cycle. For someone, 22 days could be normal. For someone, 35 days could be normal. Typically, 5 to 7 days of variation is acceptable. Now, which means that in case this variation is, let's say, more than 8 days, and this kind of irregularity is coming more than 2 or 3 times a year. Now, this means that we now need to investigate and find out why the periods are becoming irregular. I know this may sound little technical to you, but for all of you who are having irregular periods, it is worthwhile to understand the entire game around the periods. So the entire game actually is played by 4 hormones. The first one is FSH, which is follicle stimulating hormone. The second is LH, which is the luteinizing hormone. The third is the estrogen. Fourth is the progesterone. Now, normally in our brain, we have a gland called hypothalamus. Now, that produces a hormone called GnRH, which then in turn stimulates a gland called pituitary. That's also there in our brain to produce a hormone called FSH. Now, this means follicle stimulating hormone. Now, this hormone then acts on the ovary to develop the eggs in the ovary. So, medically we call them follicles. So, as the follicles start developing, they start producing estrogen, and now the estrogen levels, they start rising in the blood. Now, when the estrogen level reaches a critical value, the pituitary senses it and releases another hormone called luteinizing hormone or LH, which triggers the ovulation. I'm sure you all must have heard about those ovulation testing kits. So by those kits, actually we detect the level of LH in the body. So that's the hormone which triggers the ovulation. So once the ovulation happens, now the ruptured follicle is called corpus luteum, and now it produces a hormone called progesterone. So the estrogen initially, which was secreted by the growing follicles, makes the endometrium or the inner lining of the uterus thick, and now the progesterone basically prepares it for the pregnancy. In case the pregnancy happens, meanwhile, the bed inside the uterus is nice and ready to receive the fertilized egg. While if the pregnancy does not happen, the levels of the estrogen and progesterone, they come down, this endometrium dies and it sheds off in form of a monthly period. So typically the menstrual cycle has got 2 phases. The first phase is known as the pre-ovulatory phase. It is also called as proliferative phase, or it is also called as the follicular phase. The second phase, which is the post-ovulation phase, is known as the post-ovulatory phase or the luteal phase or the secretory phase. Now, the first phase of the menstrual cycle is variable, which means because of lot of reasons, the eggs may develop very slowly or may take a very long time to develop, increasing the length of the pre-ovulatory phase. While the second phase of the menstrual cycle is fixed. So post-ovulation is fixed, which is 14 days. So the length of the menstrual cycle will actually depend upon the length of the pre-ovulatory phase. So anything actually which disturbs the ovulation will disturb the cycle. So now you can understand, in case the ovulation is happening late, or it is irregular, or it is not happening, this would have a bearing on the length of the menstrual cycle. So now let's discuss the causes of the delayed periods. So all delayed or irregular periods are not always abnormal or sign of illness. Now there are certain physiological reasons for irregular periods, which means they are natural reasons. There are certain phases in a woman's life where the periods go irregular. For example, in the beginning, the adolescent age or the teen age, when the girl starts having her periods. So many times, mothers come to me with their young daughters. So I just tell them this is absolutely normal. You don't have to worry about them. And the periods would eventually become normal. The second thing is obviously pregnancy. When a woman is pregnant, obviously she does not get her period. The third thing is when she is feeding her baby, which is she is lactating. So when she is lactating, there's a hormone called prolactin which is secreted in our body, which actually suppresses the ovulation. So I'm sure you all probably would have heard from the senior ladies in the house saying, okay, till the time woman is feeding the child, the periods don't come. So this is perfectly normal. Then the fourth time is when the periods naturally become irregular is when she is perimenopausal, which means when the periods are about to stop. So this is the time when the ovulation becomes irregular. This is the time actually the number of eggs in the ovary are now less. Now let's talk about the pathological or the abnormal reasons of missing the period. So like I said, any process which disturbs the ovulation or makes it irregular will make the periods irregular. So when a person comes to me with an irregular period, I like to take a detailed history. We talk about whether she's gained weight, whether she's undergoing any kind of a stress. So the number one cause of irregular periods is a thyroid problem. The second is there's a hormone called prolactin. In some people, there is extra prolactin which is secreted because of probably some kind of malfunction in a pituitary gland in the brain. The most common cause these days, what we see of irregular periods is PCOD, which is polycystic ovarian disease. So I'm actually planning to do a series on PCOD as to what causes PCOD and what are the reasons. This is a situation wherein the ovary forms small cysts and they basically produce abnormal hormones which lead to irregular periods. Another cause of irregular periods could be premature ovarian failure. Now this is a disturbing thing which is happening of late pretty commonly. In a normal person, the age of the menopause was supposed to be after 38 years, but any menopause which happens before the age of 38 is supposed to be a premature menopause. And these days we are seeing girls as young as probably 34 or 35 going into menopause. Then there could be certain lifestyle factors. So the most common cause is the excessive weight gain or the obesity or the high BMI. Another reason of irregular periods could be any kind of physical or mental stress. Now by physical stress, I mean somebody has had some serious illness in the recent past, somebody has undergone a surgery. Mental stress means, somebody's exams are approaching. These days, because of the COVID, people are indoors, they are probably not very happy, upbeat. Some people are losing job, financial stress, relationship stress. Any kind of excessive exercise also is not very good. So I tell this to everyone, exercise should be moderate. You really do not have to go overboard. So you must have heard people who are into high performance sports, people who are marathon runners, they also experience irregular periods. Medically, there could be certain medications, if taken, can cause disturbed periods. For example, certain medications which are taken for endometriosis, progesterone, cancer drugs, certain psychiatric medicines. So these are also things which can disturb the periods. So now let's talk about what can we do to tackle the problem of irregular periods. So the first and foremost is get yourself investigated. Needless to say, diet plays a very important part. What do you eat? How much do you eat? How do you eat? How do you cook? When do you eat? Everything is very important. So eat the food the way nature wanted us to eat. The food should be simple, freshly cooked, seasonal, local. Avoid junk food, avoid packaged food, avoid refined food, avoid plastics as much as possible. So plastic containers actually contain a compound which is known as xenoestrogen, which actually mimics the action of estrogen in the body. Then yes, of course, be physically active. Remember, you don't have to torture yourself. You don't have to really hit the gym very hard or maybe lift weights. You have to ingrain the physical activity in your lifestyle as much as possible. Of course, the exercise should be a happy exercise, which means that you must look forward to doing that exercise. It should be a sustainable exercise, which means even 6 months down the lane, even 1 year, 2 years down the lane, you should be seeing yourself doing that exercise. So needless to say, you need to manage your stress. I know this is very easy to say that you should manage your stress, and people might tell you do meditation, listen to music, go for walks, but somehow I always feel that you must address the root cause of stress, whether it is the job or the relationship or the financial or whatever, because unless and until that is done, the stress is going to come again and again. Very important, rather very important, the sleep hygiene. So the periods actually happen because the hormones in our body are released according to the circadian rhythm. What is circadian rhythm? Is the day and night rhythm. So if you sleep, let's say at 2 o'clock in the middle of the night and get up at 10 o'clock in the morning, obviously the poor hypothalamus and pituitary are confused. What kind of hormone should they make now? So remember, sleep time is important. Sleep, the adequacy of the sleep is important. The time when you sleep is also important. The quality of the sleep is also very important. Never compromise on that. And how can we not talk about yoga? It's the entire package. What is yoga? It works at your stress management. It builds up your physical capacity. In the scheme of nature, a woman was not supposed to be having irregular periods. If you're having irregular periods, your body is desperately trying to tell you something. So take out some me time, listen to your body, nourish your body well, look after your body well, move your body well, and yes, the things can be taken care of. So if you found this video helpful, please like, share and subscribe to Maitri, and I'll see you soon.